Nasal polyps. Nasal polyps are semi-translucent, grape-like structures that form in the lining of the nose and sinuses. They often develop due to swelling or fluid retention in the mucosal lining. Though soft and painless, they can grow and lead to a variety of symptoms and complications. Nasal polyps may contribute to nasal blockage, breathing difficulty, and other sinus-related problems. Understanding nasal polyps is important for recognizing symptoms early and seeking timely care. Causes. So, how do nasal polyps actually form? It all starts with inflammation in the nasal lining. This inflammation happens when your body reacts to bacteria, viruses, allergens. When these foreign particles enter your body, your immune system fights back by releasing chemicals and immune cells. But here's the problem. While fighting infection, this process can also damage your own tissues. In some people, the system that clears these inflammatory chemicals doesn't work efficiently. As a result, toxins and inflammatory substances build up. Fluid gets retained in the nasal lining. This, along with ongoing inflammation, like sinusitis and tissue damage, can lead to the development of nasal polyps in the nasal passages and sinuses. Symptoms. Patients with nasal polyps typically experience symptoms similar to those of sinusitis, like running nose, nose block or stuffy nose, headaches, facial pain, postnasal drip, phlegm flowing to the throat, sore throat, a necessity to clear the throat frequently, persistent cough. But here's a key sign. Nasal blockage is more severe and constant in people with polyps. So if you experience these symptoms, don't ignore them, consult an ENT specialist. Diagnosis. Diagnosing nasal polyps involves a few important steps. Diagnosis usually starts with a nasal endoscopy, where a doctor examines your nasal passages. Depending on the findings, medical treatments may be tried first. If symptoms persist, a CT scan of the sinuses is done to check the extent of the polyps and any damage. Additional tests, like nasal cultures or tissue samples, help identify infections. Once these diagnostic steps are completed, doctors will tailor the treatment plan accordingly. Treatment. Now the big question, can nasal polyps be treated with medicines? The answer is, it depends on the stage. Early stage, polypoid changes baby polyps. Can be treated with medication. Fully developed polyps. Do not respond well to medicines. Require surgical removal. But treatment doesn't stop there. Doctors also treat the root cause, like sinusitis or allergies. Surgery plus treating the root cause equals complete cure. But if patients neglect their postoperative medication and fail to adhere to regular visits with their surgeon, the chances of polyps recurring are significantly higher. So, it is important to stick to the prescribed treatment regimen and maintain regular checkups. Home remedies. For early-stage cases, one helpful method is jal neti, a traditional nasal cleansing practice. It helps remove toxins and may slow the progression of polyps. But remember, this works effectively in early stages, not for advanced polyps. If you're struggling with constant nasal blockage along with other symptoms, don't ignore it, get it checked early. Early intervention makes a big difference. To know more, please read our article, Nasal Polyps, Causes, Symptoms, and Treatment Options. Link in the description. Stay healthy. Stay happy.